got the cue for the Q&A. So, any questions for our speakers? Would you like to come down for the questions? And Pete, also, we can have you back on the stage. Yes, please, go ahead.
Thank you so much for these wonderful innovations that you shared. My name is Israel Balogun. I'm a PhD student at UCL. I'm also a person with disability. We lived the experience. I had poliomyelitis at 9 months old, and I will be 49 very soon. My question goes to you. In reaching out to services to children with disability in schools, because this thing that you talk about, I mean, this is the first time I'm hearing it. I have classmates that we grew up with disability. Nobody ever told us how to use assistive technology. I mean, we just had to learn it by ourselves, adapt it, and go on. So, how do you convince some of these children to embrace these services in the first instance? That's my first question. The second thing is this: beside taking these services, there's what we call low self-esteem among children with disabilities. How were you able to add more skills for them to be able to adapt to the discrimination, the stigma, the low self-esteem that they do have among their contemporaries, to be able to face some of the challenges of living with disability among their peers without disability? That's my first question for you. I'm really, really happy with your innovation in Sierra Leone. I mean, it's an excellent thing, and I must commend you for what you're doing. I've worked in Sierra Leone. I know Dr. ABS very well. My question to you is this. You talk about scaling up, which is actually a major thing. The part I'm even happy with you is the user-led feedback that led to the improvement of your product. Have you thought about partnering with the private sector or government agency? I know Sierra Leone is not, it's more of a low-income country. They've just come out of civil war. Have you thought about that so as to go forward in scaling up? Because those ideas are very, very innovative, and I know of a lot of philanthropic organizations that want to support that initiative. That would be my question to you. Thank you so much.
So how do we get young people to engage in the sessions? Well, wheelchair skills are a fun thing to do. So we're in the sports hall. It's a very physical session. It's not. It's taught in a progressive way as well. So it'll be a demonstration. It'll be practicing. It'll start with simpler skills and building up to the more complex skills, the tougher skills. So everyone can start and everyone can see that progression in themselves. So you've got that feeling of success, building self-esteem through the progression as well. So they kind of ride that wave to test it out a bit more and test new things. There's lots of games involved, which I think, well, to be honest, it goes down well with adult sessions as well. You can use a lot of playground-based games and incorporate them into wheelchair skills because they use a lot of the basic movements. So whenever I go into a school I've been to before, I say to the kids, what game do you want to play? Without fail, it's always Bulldog. So I don't know if anyone's played Bulldog, but it's basically a game of tag. And the thing I like most about Bulldog is how quickly you can see the confidence raised in children. So I've done a lot of work in special schools, working with children with profound and multiple learning difficulties, and even children with limited vocabulary. We can get them in the center of the room and they'll volunteer to do it. And then they'll do the start of the game. So they'll all go 1, 2, 3, Bulldog. And it's such a small thing for what we might perceive as a small thing. But actually, you can see for them that it's a big thing and it takes a lot of confidence to do that. So making the sessions engaging, and the same for the classroom sessions as well. So I did a session on using public transport. So we got lots of pictures in there around different types of public transport, talking about experiences on public transport. And then we rearranged all the desks and the chairs, and we did a role play for buses. And we did a mock-up of a bus where one of the kids was a bus driver, and we'd open the doors and they'd practice going up this ramp and parking their wheelchair in the bus space. So we make it really engaging, and we want them to find it fun. And in terms of those wider skills that you mentioned as well, I'm at the very start of this now, and I'm using a couple of sessions that develop certain skills that I think have meant a lot to me and what I see are needed. But the very nature of this program is that once it's scaled up and scaled out, it's going to be a two-way conversation. I'm going to be listening to what people want and need, and then the program's going to naturally evolve and to include all those things that you said. Thanks.
I'll just add to one more point before we move to Nell. In one of the conversations that we are having, talking about your second question about these understanding of the stigma and discrimination, we spoke about the involvement of parents as well in bringing them and getting them aware also about what is it to be a child with a disability, and to help them understand what they are actually, what children should be capable of doing by themselves. So I think that is also one conversation that we had.
Yeah, definitely. So as well. I think making resources available for parents is really important as well, because these are the sources of information that children go to. But if they've had no experience of disability before, then they wouldn't know these things. So you need to take it back to the fundamentals of basic things around disabled life, because they may be getting all their information from medical professionals, but actually we need to be talking about things like the social model of disability and what life looks like. So it's about educating the entire ecosystem.
Yeah, I think the second part of your question was to do with partnerships and working with the private sector, with reference to Sierra Leone. So yeah, I mean, we're in the private sector ourselves. We do work with all sorts of different organizations. So like I said, NGOs, with governments, and with the private sector. So in Sierra Leone, not specifically is the short answer, but in different places around the world, we are looking at things like manufacturing. Can we manufacture in hubs or locally to reduce, because at the moment we manufacture in the UK because of the scale. But, working with, for example, in Sierra Leone, one of the parts of our prosthetic is a fabric cover. And you could work with local tailor shops and people that sew to be able to manufacture some of those. And we would reduce having to ship that, and we'd also be able to reduce the cost. So it's definitely something that we were always thinking about and partnering with people on. No worries.
One question.
Shall I?
Yes.
Okay. Great work. I'm Sujata Srinivasan. I'm from IIT Madras. I think, Pete, you've been in speaking to Justin and the Thrive team. So nice to meet you. And it's great work that you're doing. And it's really nice that you're catching them young, the wheelchair users in the schools. So I had a question. Is this something, the wheelchair skills training, is this something that's covered by the NHS? Does insurance pay for it? Like, what is the sustainability model for your business? How would you do that? And I'll come back to you also, Nia. It's a similar.
So wheelchair skills training isn't something that's currently offered by the NHS. You may get very small pockets delivering like one-off sessions maybe, or showing briefly how to use a wheelchair, but nothing that's done on a peer model. So people who have lived experience, and not something that is sustained enough to reiterate those messages and that learning as well. And the model that I'm looking to roll out is something that works with local authorities. The two things that I've wanted to make sure I have from the start is scalability and sustainability. And wheelchair skills, they don't have a financial return on investment, but they do have massive social return on investment. The confidence and the independence that everyone can gain will have massive impacts on the rest of their lives. So I want that investment from local authorities, and it doesn't take much once you get enough local authorities involved. So I'm partnering with a charity at the moment who already operates in that way. I'm looking to scale up in that method.
Absolutely, it's so essential, and it should be covered by insurance. It's something that should be an essential part of using an assistive device. Providing the training for it. So Niall, also wonderful work, and hardware startup is really, really hard to do for you to cross the valley of death and all that. Do you also do you have customers in the UK? Is that I?
Yeah. Yes, we do. So we because we're from the UK, the biggest project that we've done was called Project Limitless, and that was aiming to get a upper limb soft prosthetic to every child in the UK, something that we've got actually really close to.
Oh, that's great.
So we did start here, and we're not only for children, it's for all ages. But yeah, so like I said, we have something that we think could be relevant everywhere. I think the same as yourself, actually. Like, this is something that is a need everywhere. So in terms of sustainability, creating a business model that's truly sustainable, I think, is a mixture of things. So it's working with the NGOs and the ministries of health in the low-income countries and conflict zones. But it's also working with healthcare providers like the NHS or private insurance in the States, things like that. Or just people purchasing directly from us. So we have quite a few different things in order to be a bit more resilient.
What are some of the challenges in terms of, I know connecting with NGOs and all that, but in terms of like certifications and things like that, have you encountered any challenges and how do you overcome them?
Slightly easier for us because we're in a Class 1 medical device. But still, we need to be certified. So we started with Europe and then America, so CE and FDA. But as we scale up in other countries, yeah, of course, we need to abide by the local medical regulations. So something that we just have to encounter.
Sorry for being rude. I know innovation can go for overnight and take days, and we can discuss this forever, but we don't want to be in the way for lunch. So let's get some food in our bellies and resume our discussions over there and after lunch. So break for lunch now. Thank you, everyone.